So we'll let our speakers introduce themselves to you, and maybe they'll share a little bit about their experience in this area and a little bit about the work that you're doing in this area. And hopefully Dr. Spencer will pop on. He was actually seeing patients in clinic in Richfield today, and so is probably going to pop on a little bit later. So Maren, do you want to start?
Sure. So Dr. Maren Voss, I work at Utah State University Extension, and if you're not familiar with the land grant university system, we have extension offices out in all the counties, and the university extension system just started realizing there was more of a need to bring community resources to focus on health, and they started a new initiative called the HEART Initiative, Health Extension Advocacy Research and Teaching, that really was primarily going to help support the opioid overdose, trying to reduce harm in Utah around that topic. But as health extension faculty, we get to work in the whole health space. And so a lot of us have focused on suicide prevention as well, since that's also one of Utah's critical health issues. And so that's some of the work that I've been doing out in Tooele. And I have a clinical psychology background, so that's an area that's really interesting to me. So that's my background, what brings me to working in the space that I'm studying.
I'm Teresa Willie. I'm currently the coordinator for the Reach for Hope Suicide Prevention Coalition in Washington County. And we are the only coalition statewide that focuses exclusively on suicide prevention. So I was instrumental in getting Hope Squads to this area. Started at one school, and now we have 17 secondary schools with Hope Squads. So that's really, really fun. I've been doing suicide prevention for about 15 years in my job, and prior to that, substance abuse prevention, which we know if we get far enough upstream, we're addressing the same risk factors. So that's one of the things that we work on, is trying to get upstream and address risk factors that trickle down to both. I oversee Washington County Prevention Services, and
Well, thank you both for.
I had a question, sorry, maybe what level of schools?
secondary. So anywhere from our intermediate, middle, and high schools.
That's what I was wondering.
Yep, we currently have an interest from 2 elementary schools, but we haven't implemented there yet. Yeah.
We want to thank you both for being here today. And as I mentioned, Dr. Jesse Spencer is a family practice doc in Richfield, and he'll be joining us hopefully soon. But and when he does beam in, if you don't mind, I may just acknowledge that because your backs are to the screen. So I'll kind of give you a timeout and let him introduce himself. But this is such a timely topic, especially with the pandemic. We know the pandemic has exacerbated so much in this area. So we hope that we can touch on that a little bit. But tell us a little bit about what you're working on and where you see projects happening.
Yeah, so as I came into Tooele and heard about some of the needs, I did a little bit of my own deep dive into the research on what were the most effective approaches for trying to do suicide prevention. And the research I found suggested that, if you can do just a full on multidisciplinary, multi-pronged approach in a community where the health system is doing screenings at every doctor's appointment, where the schools are doing education, where it's like, at every level, there is a focus on suicide prevention. That works the best, but that tends to be really hard to implement. But beyond that, suicide and gatekeeper trainings were one of the most effective approaches. And so the state has endorsed the Question Persuade refers suicide gatekeeper trainings, and the Utah Departments of Health Suicide Coalition teaches those trainings, keeps an updated curriculum out there. And Tooele County was already way on the ball. They do a great job with their QPR trainings. They have this great approach of working with the school districts. And so most 10th grade high school classrooms in the health class run a QPR class. They have a communities that care model out there where they're actively recruiting groups to take the training. And so they offer a couple at the city office building each year, but more than that, they're doing multiple in like church group settings and in any sort of like at the Chamber of Commerce setting, like, anywhere they can get to get this message out so that everybody is constantly thinking about what can we do about suicide prevention. They also have a Life's Worth Living Foundation, where it's a community-based specific suicide prevention organization that works really hard to try to keep the message forefront at the same time. So I'm one of the people teaching, facilitating the QPR classes out there. But in terms of COVID and the response, the state told us that they did not have an increase in their number of suicide deaths that were reported over the past cycle. But they are getting more crisis calls in these crisis lines. So we definitely know that people are having more behavioral health crisis, even if it didn't in Utah connect with a higher rate of suicide deaths. But I know that just in my own family, my son, who was a senior in high school as COVID was hitting, had a huge behavioral health crisis and ended up hospitalized for suicidal ideation. And it's like, it's hitting hard. It's just like, it's not something that's going away. So that's a little bit what's going on in my area locally.
I missed it. Is it TPR? Is that what you?
QPR, question, persuade, refer.
Okay.
And so it's just a community-based training that teaches people how, like CPR, how to just be aware of the signs of crisis and to take that first step of asking if a person's having a struggle so that they can connect them to care is the idea of a gatekeeper
It's a
training.
very quick training.
Very quick.
It's an hour and a half. And we have our pipeline program on 4 campuses. Every pre-med student as a freshman does this. And I always say it's the first tool in their toolbox. And as freshmen, I'm surprised how few have had it. So I'm glad to hear you're doing it in high schools. Teresa, is that happening in Washington County?
We are doing it in Washington County. They're doing it through the counseling department. So counselors will go around to core classes and train students on PPR. We also do a Hope Squad training with all of the Hope Squads. And so we'll train 500 kids on QPR. And then they also get a training on boundaries and self-care and in addition to that. So, but we've currently, up until the pandemic, we've been training about 1,200 people in Washington County on QPR every year. And the university's been great because they've been one of our biggest trainers. They train hundreds of students and faculty every year.
So I work at Dixie State and then I work at SU. SU has very few trainers. In Dixie, it is all of campus.
Yeah.
So just the difference in 2 public institutions in Southern Utah.
Yeah.
So I don't know if it's making that difference.
Well, the Booth Wellness Center has been really, really helpful in promoting whatever Reach for Hope is doing as well, because they sit on a coalition. And so they're heavily involved in all of the strategies that we're doing, as well as getting the PPR trainings out there. So
Would you
it's
maybe
been
share
helpful.
what the Hope Squads are, what they do?
Yeah. So Hope Squads are, they're basically the eyes and the ears for the schools. Those students are nominated every year by their peers as good helpers in a crisis or good helpers to get resources to other people, good listeners. And they nominate, each student gets a chance to nominate 3 other students. And then they gather those data up and look at about the top 40 kids in each school. But we also try to make sure that we're getting a good cross section. So somebody from each of the different sub-communities in the school, someone from different ethnicities, someone from different kinds of just subcultures. And then those students come together. They have to have their parents accept that responsibility because it is a responsibility. And their job is to listen and be aware of students who might be struggling, and then bring them to the counseling office, create a bridge, call Safe UT, which is the Suicide Prevention Lifeline Utah, I guess, prevention. And so their goal is to not carry this burden or keep secrets. We train them to get rid of that and help build a bridge to resources that can be helpful. So they know how to ask the question, they know how to persuade their peers to get help, they know how to build bridges to resources, and they're really good at that. And I personally have experienced multiple times when students' lives have been saved because they've had a peer. We know that, 90% of kids that are struggling are going to tell a peer before they tell an adult. And so And the goal was for those kids to be able to have that training. I know we've had some concerns about, gosh, we're putting these kids in a position where they have to receive hard information from their peers. But what we know is that they were already getting peers reaching out to them when they were struggling. And so now they have tools that they know how to manage that. They don't carry those burdens themselves, and they don't keep deadly secrets, and they know what to do with that information. So we're actually empowering them to keep themselves safe, as well as keeping their peers safe.
And are there Hope Squads all over the state?
In
Do they
fact,
exist in rural communities?
yeah, Dr. Greg Cudmel started Hope Squads in Provo. He was a principal up there and responded to a really young child's death. And so he thought, we've got to do something different. And so he started a Hope Squad up in Provo. I think Tempe High was the first one to have it. And then in my naivety, learned about it just because I had heard through the grapevine that they were doing this. So I started one at Pineview High, and we kind of were just making it up as we go until I found the right people that could direct me into an evidence-based program. And so from there, it's grown, and now it's a national program. They've got Hope Squads all over the world.
It's on the website. I just looked it up.
It's pretty amazing, isn't
How
it?
long ago did they start?
It's less than 20, I want to say less than 20 years, do you know?
I
It's
don't.
probably on the website.
I was
So,
curious.
I don't know for sure, but somewhere between 15 and 20 years.
Tooele definitely has Hope Squads in the high schools. I'm not sure about the other counties.
Those kids honestly are they're the magic, and they're the most, it's good energy hanging out with those kids. It's just a good part of our lives.
Teresa, we have them in our small communities too, in the smaller counties.
Yeah,
So
and
that's not rural, we've got them in our very.
yeah, all of our rural counties have Hope Squads as well. And we invite them to the bigger training. So this past year, Dixie Tech has graciously offered their facility for us to do that day-long training. And this year, that 400-person facility wouldn't accommodate all of the students. So we ended up doing 2 days of a single-day training and trained about 600 kids. And it was pretty awesome. So that was inviting Iron County and King County and some of the other outlying counties as well. I think the trainings for Beaver and Painted Europe.
And I have to bring it up because it's the elephant in the room. We've also in the news, we've had a very public suicide issue with a very young child. I think that was very surprising to all of us, that a child that age would even think about this. How your systems that brought through this, and what are some of the reactions?
One of the things it just makes me think of is one of the things I hear, there's been a lot of suicide prevention training and building around protective factors and preventing risk factors, but I'm hearing more and more the need for postvention training, and there's starting to be some of those evidence-based programs cropping up. But in our community, they haven't been taught broadly. And so I feel like, people are starting to realize more the need, like we have a mobile crisis team that like addresses after an event, going in and trying to support the system. But there's more people feeling like we need to know what to do after, in the aftermath of suicide in order to minimize the risk of contagion and other things. So I think that's more what I'm hearing. It's like, we don't know what to do. We need to learn specifically how to respond.
Especially when we're talking about a 10-year-old, we're talking about Hope Squad for preschools, but this is elementary.
Yeah,
And you said you had elementary schools asking about
we've got a
programs already.
couple of asking, yeah. So they haven't implemented yet, but, and I love what you said about postvention, because what the research is showing is if you do good postvention, that is good prevention. The way we respond in a crisis, following a crisis, is good prevention. And so what a couple of the strategies that we're using in our county, we do ongoing trainings for our media so that they know how to deliver safe messages, that they know not to sensationalize, or they know that when there is a crisis, that really the bottom line when they're reporting that is not to focus necessarily on the what that happened, about getting resources out there and guiding people who may be struggling to additional resources. In our community, we created about 500 comfort bags for families. So when they experience a loss in their family, or if someone in their family attempts, we take this resource to them, and it's got a blanket in it, and it's got a couple of other stress management items in there, but it also has a lot of resources. It contains grief counselors in the area that people can reach out to. It has resources with the Live On campaign, and it has resources with our website. It has QPR trainings, and I know that sometimes we think, well, gosh, it's too late to do a QPR training. One of the gals in our community, who is a dear friend of mine, lost her husband to suicide a couple of years ago. And one of the things that she does on the anniversary of his death is she hosts a QPR training so that her friends and family can learn what they can do to help other people. And it's amazing because these people are not coworkers or we train teachers, we train workplace, we train churches. These are her friends and family that she's building protective factors around so that they won't experience the same kind of grief that she's experienced. And so, we do provide a lot of post-vention things, and I think that's a really important thing especially when we lose a child, that we are reaching out to that family. We know that when we lose a child, the contagion is about 5% for young people. And so making sure that we're building a safe space around those people that are impacted is really, really important.
Yeah, I practiced in the two primaries, and it's probably longer than this, but I thought it was about 8-10 years ago, we had a real almost epidemic of hangings. And as it was going on, the age was going down. So we're having not 10, but 12 and 13-year-olds who hung themselves, which was really unusual for that thing. But we were really frustrated, but at that time, there didn't seem those community resources. So applaud you for.
So the state has been putting together some of the, like you said, the media trainings, kind of like how to respond after an event at their liveon.org group. But they point out a few of the things, like having rules in place so that anytime a youth dies, the schools memorialize it in the same way, the same number of days that, and the same sort of format, so that
There's another kind of death.
Yeah, as any other kind of death, so that there's an especial attention to a suicide death. There's just some simple policies like that communities can think about, so that so we can try to minimize contagion and not treat this death different than anything else.
Absolutely. Yep. And we've had those policies in our district as well, and in the 5-county area. Our crisis team does training with the crisis response group, but also all the counselors in the school district. Same thing. So.
I was thinking in this recent public case of a 10-year-old that died by suicide, that it had been mentioned that bullying and such was part of the problem. And just as they look at some of the factors in youth suicides, that bullying is obviously one of the issues. It's a big concern, but one of the others that shows up is girls who spend a lot of time on social media. That tends to be a risk factor, and so I don't know what we can do to address that as we think about the ages getting younger and never people having that social media time. That's certainly things we need to be aware of. I don't certainly have any solutions to it, but it's concerning.
Yeah, that's really stressful.
You mean, I feel really helpless in face of social media and its influence on our youth. Is it a legislative fix ultimately? I mean, is it only at the parental level? I don't.
Huge difference.
That is a good
Huge,
question.
ugly Pandora's box.
So we currently are trying to get a little bit upstream in the way that we're educating the public too. We have Christy Kane actually coming tomorrow night here, who is the expert on how technology impacts young people and the adolescent brain and their mental health. And so we're trying to get parents here. That's the hard part, so that we can educate them so that they can start making changes in their home and monitoring their kids' tech use and content. And then hopefully at some point we can make a difference on the impact that that's having. But it's hard. I don't know how you legislate that, but unless you're doing it at home, that's a hard thing.
Well, community coalitions certainly, like you can see from hearing everything that we've talked about here, Twila has had the same approach. I'm not the leader on the community coalitions, but they've had the same thing. And we've had Christy King come to our community because of those same concerned parents wanting to provide the information that's needed. And so the parents out in my community have gotten the same sort of messaging and how to protect their kids. So I think community coalitions are one of the answers to try to address these problems going forward.
Agreed.
Are there any like resources out there for those who might be like in the LGBTQI plus communities, or that you can give them before they start to talk about self-harm or anything like that, that these Hope Squads don't have to catch word of, but they can be engaged on?
So
their
every
own way?
QPR training mentions the Trevor Project, and I'm not even sure, is that Salt Lake or is that
That's
national? That's a national. So there are, partly because that community has higher risk of suicide, those trainings definitely make sure to make a point of mentioning specialized resources that are available. So I know that's happening. I don't know about younger than that, or in the schools outside of that.
But one of the things that we've done in our district last year, we hosted the coalition hosted, whenever I say we, it's our coalition, it's certainly not me. But the coalition hosted a safe zone training, which is a training to help any individual understand how to create a safe place for the LGBTQ population. And so we came in for a full day and trained all the school counselors, 80+ counselors coming to that training. We spent the day, we had Dr. Toy from the university come and do the presentation for them. But we also partnered with Ann Circle House. And I don't know if you guys are familiar with Ann Circle. And Circle, it's just such a lovely organization, but they started in Salt Lake. And the woman that started this had a family member who was in the LGBTQ population. And so there was, saw this need to create a safe community for young people. And so young people from 12 to 18 can come. They also do counseling with parents and kids so they can navigate that relationship in a healthy way. They do after school programs. They do, gosh, I can't think of, they do a lot of things, but we partnered with them on a lot of things as well. And during the pandemic, we reached out specifically to that population with self-care bags so that they were developing coping skills and finding healthy ways to find resources specific to them. So we partnered with them a lot. We actually have a big event coming up next week, if I can plug this. I'm super excited about it. But it's a big family event targeting all families. But we're talking, it's a partnership between Parents Empowered and the Ann Circle House and Reach for Hope and our school district and our city and Intermountain. And what we're doing is coming together for all families, and they're installing an art project down in Town Square. And it's a big mural on, they placed an install there, but it's a big mural that kind of is a line drawing of Washington County. And in front of it, the Bike Collective built a tandem bicycle. And the message behind it is, whatever your child's journey, go with them. And so we'll talk about why the LGBT community is higher risk for suicide, for substance abuse, for other problematic things that might come up. And then we'll have a big press conference and speakers, and then we'll attach that to a slow roll for families. So it's like, go with your child, and we'll have a big bicycle event and help families ride around a certain route that we've created in town. The mayor speaking, and Doug Murakami from the DABC is coming down, and Benay Larson from the Utah Prevention Coalition's coming. We have some really amazing people across the state that are going to come support this. So those are some of the things that we're just trying to cross over and reach some of those at-risk populations and connect them to resources.
So I know that in the rural communities, we also have underreported suicide. And I've heard that, lots of reasons for that. So we realize that the struggle in our rural, Utah's percentages are higher, and rural Utah is even higher. And yet there's this incredible stigma that's out there. Can you talk to any of them a little bit about
I'm not a total expert on the stigma. I do know that farmer mental health has been at a crisis point recently, and we do hear that that often suicide in that case is disguised as a funny accident. And so
hunting
hunting accidents. And so we definitely that's been acknowledged. There's some extra funding and programming specifically around farmer mental health, with similar to a QPR style presentations, or there's some other youth mental health first aid, where it's just sort of, these are the basics, and sort of normalizing reducing the stigma in terms of everybody has stressors and that it's okay to ask for help. So that programming is going out through the extension offices. And so we're putting extra emphasis there. But I don't, there's again, still no big solution to handling the stigma, but hopefully that education is a little piece of the solution.
Yeah, and I think honestly, that's one of the few positive things that's come from COVID, is that one of the reasons that we are hoping that crisis calls are up is because more people, instead of suffering in silence, we're normalizing that help-seeking behavior, which is really great. And my colleague in Beaver, I was having a conversation with her last night, and she said more of the at-risk kids that she's working with this year are willing to say, I'm going to therapy, I'm reaching out, I'm doing. And so I hope that that's one of the few positives, but that has come from COVID, is that people are realizing we all struggle, and it's okay to struggle, and it's important to reach out for help with those struggles. And so I think that has been something that's been
I
positive.
think that's what I was alluding to, with the stigma, especially in our small rural communities. It's, it's disgraceful. We know that for folks in recovery, they don't want to see a car parked at the behavioral health center and things like that. So there's such a stigma around. And how do you break that in tiny rural communities?
Another group that is similar to farmers in rural America in terms of stigma would be first responders, law enforcement, and there's a recent analysis of help seeking in the Salt Lake area for what do they call it, fire group? Unified Fire.
Unified Fire Authority.
And they had doubled their help seeking over that last year that they were assessing. I know University of Utah and USU have both been involved in several programs to address resilience and mental health in first responders, first recognizing the trauma and everything that they face on an ongoing basis, and recognize how hard that could be to manage, and then getting them to be willing to sort of talk about and get help around that topic. And so that's another group that seems to be doing a little bit more help seeking as we reduce the stigma around mental health services. And so maybe that's starting to spread more generally.
I think you're right about that too. We, a couple of years ago, we approached our law enforcement agencies in Washington County and said, would like to come teach all of your personnel QPR, all of the officers. And they were like, but 2 years ago, they welcomed us, and we trained 4 of the departments, their whole department, St. George Department, Ivan, Santa Clara, Hurricane, Liverton, all of those departments, all of their officers are QPR trained. And we also did a training in Bryce Canyon in the summer for the State Firefighters Association. And they had us do like a mental health kind of an overview for the whole conference. And then we did QPR training for the auxiliary, so the wives or partners of these firefighters, so that they could really understand how to ask their partners, are you struggling? Ask them the question. And so I feel like you're right. I feel like the stigma's kind of starting to break a little bit in some of those tougher communities, and we're starting to make a little bit of headway that way. And also those organizations are becoming pretty proactive at having, I don't know what they're called, but something within the departments where people can go that are struggling and there's no consequences. It's anonymous. I don't know. Yeah.
EMP programs, is that?
Something
Employee
like
assistance
that. Yeah.
programs.
Employee assistance programs. Yeah. So that's helpful too. And it's hopeful that we're moving in the right direction.
Especially our healthcare providers too, who are on the front line during this pandemic. I'm just a little curious, as you said, the calls are, increasing, things like that. Are the resources for them increasing? We've got behavioral health shortages out there. It's great to get people to ask for help, but what do we do with them?
Good question.
I think some of the resources, we are short mental health crisis workers. We have long wait lines for people to get into long-term care or to therapists, but Intermountain, Jordan, you want to tell us just a little bit about what Intermountain's done to increase resources for the whole population?
A number of things. So they've made their access centers more accessible than they were before. With COVID, they dropped. There was a new line. They just stood it up in about 10 days. That it was a behavioral health line where anybody could call in. There were behavioral health specialists free. It's just another free thing where they could come in and they could call. And now they've transformed that into a behavioral navigation line. Same number, same hours where people can call in and not just have somebody to talk to that might need to walk them through a crisis or just maybe some emotions that they're dealing with. But then their whole role is to be able to further the help those people can get. So they navigate into the help they need, whether it's through Intermountain or through another facility or through another venue. So that's the whole purpose of that navigation line. It stood up. I mean, it was really quick, but the need was so high because of some of those high crisis calls that were coming, and we weren't ready for it. And therapists and getting into an appointment, we knew that we were behind the gun, behind the game in all of it. So that's been a big one that's helped. And then the telehealth aspect, both in our schools, a lot of elementary and rural communities, they're standing up some telehealth options that are huge, and they're starting to get more accessible for behavioral health needs, crisis and other things. That it's still a new game and a new gamut for insurances and different things like that, but they're making it accessible now in some of our rural communities. So those are some of the things.
So in terms of the crisis lines, Utah's put some extra funding into Utah Neuropsychiatric Institute's crisis line funding. So they have more staff there, staffing peers on their crisis line as well, which I'll mention in a second. But they also, I heard recently, is it 988? Anyway, there's going to be a new behavioral health crisis line that is going through the legislature right now that should be coming out very soon. So those are, call-in resources that are expanding, which are nice. But I would put a big pitch because I don't think we're going to address our behavioral health workforce shortage anytime soon. I'd put a big pitch in for more peer support professionals at every level of the healthcare system. Like I said, they're staffing more of those peers on the UNI's crisis line as they receive those crisis calls. But peers are people who have lived experience with either mental health or substance use issues, go through and get certified. And because of that lived experience, they connect with people in a totally different way in terms of giving people hope for getting through the crisis and getting to the other side of it. And so, and because they're paraprofessionals, it's a really cost treatment professional. It's someone who's still developing their own career trajectory. So someone that we can find staffing for. So I think it's a nice workaround until we find a more long-term solution to our behavioral health workforce.
I agree with that. And I feel like too, we have the warm line now, but they've also expanded safe UT for frontline workers. So some of those things, like Jordan was talking about, like you're talking about, all of a sudden we find ourselves in this crisis and we need things. And so I think our state has done a really good job at implementing things in a hurry that are going to be sustainable and long lasting. And again, those things I think have reduced the stigma as well. Because the more we talk about it and the more resources that are out there and the more people that are using them, it's normalizes that help-seeking behavior, which is one of the key things that we can do that's positive.
So I think all of us who have been parents or are parents, you know, wonder at what age do we talk to our children and what curriculum is appropriate to use at what age?
Question.
I think that depends on the family and the circumstances and the mental health history in the family. I've got a dear friend who attempted, and she's okay and she's doing well, but she has young children, and she said, I don't know at what age to talk about that with them. So instead of talking specifically about suicide, they started talking about self-care when those little kids were 5 and 6 years old. Now they're teenagers. And they've transitioned into that, you know. Some people in our family have struggled with health with their brain, and they've talked about that in a way that they would talk about, grandma has diabetes, and so she has to avoid sugar. And so just talking about it in a normal way that we would talk about any other kind of health issue. And then engaging your own children if you have a mental health history in your family. Of course, you would want to address that a little bit sooner and a little bit more in depth. But I think, you know, we don't want to give kids information that they're not ready for either. But when you are in the 4th grade and you lose a peer to suicide, they're going to hear those things. And those kids that have been closely exposed need to understand that. So I don't think there's any hard fast rule. What do you think?
I personally was appalled. Is it 13 Reasons Why that was the sitcom? Is it something about like the name? I was appalled when it came online from a behavioral health perspective, and really pushed for more of an outcry and outlet, you know, of parents saying that we need this to not be around for our children. But when you have a 10-year-old completing suicide, it makes you or dying by suicide, just makes you wonder, like, how did that even get in the 10-year-old's mind, and what are the influences we have in our society that make that something that it could be contemplated and considered. When I was early in my behavioral health career, self-harm was very, very rare and a sign of serious mental illness. And now it is everywhere at just minimum levels of anxiety before there's even a level where you would diagnose a condition, and yet still you would see self-harm. And so I don't know if we can backtrack from where we are, but it certainly raises, like, as a society, we should perhaps be trying to protect younger individuals, whether it's through media, through any kind of restrictions on their access to social media that we might choose to implement. But also we do need to have those conversations sooner than we anticipate. And that's just a reality of where we live at this point.
I would love to open it up because I know we have some medical educators out here in our audience who deal with this, and I would love to hear what's happening in your own institutions as well. Yeah.
I just, you know, and I everything you said is fantastic. You know, the big elephant often is gun control, which is a very hot topic as a pediatrician. You know, grew up hunting. I didn't have cover my guns until my kids were still. But how is the mental health professionals really trying to work with the legislator to address that specific topic?
Dr. Jesse Spencer was going
Oh,
to
I'm
address
sorry.
that.
All right.
So he actually presented at our last conference and talked a lot about that. So that was his area of expertise. We'll have to get him to videotape that and send it.
Yeah,
out
that
to
would be
you all.
very helpful.
But he also talks about gun locks and
Yeah.
you know, the gun safety and teaching gun safety. So I really wish he was here, but maybe you.
Well, it's one of the things we do at any of our suicide prevention fair events is we're handing out gun locks, and that's and
Good
the
job.
QPR. It's one of the biggest messages is access to lethal means is, you know, the biggest risk factor, and so we need to be addressing that. One of the things I like in the QPR presentation, there's a gun safety piece that's in there when it's presented to adults and not to youth. But it includes that if we aren't locking up and keeping our guns safe, then we'll lose the right to have them. So it approaches it from a, like, you know, we don't necessarily have to legislate away the right to guns unless people are irresponsible. And so it puts it on the responsibility of the citizens to keep their guns safe, because it is such a respect.
In Utah, physicians now, to renew your license, you have to do a suicide prevention module. And a large component of it is talking about gun
The
safety
comms.
and moving that,
Yeah.
the conversation into the visit,
Yeah.
which is great and new.
We love that. And I will tell you, we're so fortunate in this county because maybe 5 or 6 years ago, I walked into Rowdy's Range, which is the biggest gun range in the county in St. George, and just said, hey, you know, I do suicide prevention and I would like to do QPR training with your staff. And he said, come on in. And he required all of his staff to take QPR. Now I know we don't do concealed carry anymore in our state, and that was a battle that we lost, and it was a really frustrating experience last year during the session. But they still teach concealed carry courses in their range. They do a firearms piece on suicide in that, but it was kind of awesome because Rowdy, who owns that shop, is now part of our staff because he could see the value in suicide prevention and working with the mental health community and partnering with the firearms community. And so he's been a key component in getting those QPR trainings to law enforcement. He's former law enforcement. He's been the link to put that all together. And he also, he has trained a lot of, well, he's facilitated the training of a lot of other firearms community members to be QPR trainers, so that they're speaking to the choir when they go in and teach that, and then they're not polarizing, saying we're against guns. It's like, hey, we are guns, and we are also protecting our families who might be having a crisis. So,
I was just going to mention that Teresa and Rowdy have put together some videos that are available on the Reach for Hope page, and they address that, and they're really shareable. They're really well done videos that can go. I mean, they're really well done. It gets the appropriate messaging out there, and they put that together. So, you know, to share that kind of messaging out there on personal and work pages, I think is really helpful to share some of that messaging around guns and safe guns and how to do that. So,
What was that website? Reach for Hope?
reachforhopeutah.org.
Is there a place where all these resources are consolidated?
LiveOnUtah.org has
Okay.
tried to pull everything together. They've had a well-funded state level suicide coalition recently, and some good staffing, and they launched that website just from the past year, right?
yeah, so good.
And has a lot of new resources. They are loving to get the message out, and so if you're having any kind of community event or fair, they've got all the little swag that they'll send your way to promote their messaging. There was the Dear Evan Hansen movie that came out not too long ago. They were sponsoring booths at all the movie theaters, so there's a lot of opportunities to partner with them to increase the message in your community.
So good stuff. I brought a bunch of resources if you guys want them. I forgot to get them out of my bag. So I'll throw those out when we're done and take what you need. But
Any other questions for our panelists?
So thank you, Dr. Wright Voss, for sharing that you have experienced this in your own family, suicidal ideation in an adolescent. I don't feel I'm very good at this. I've met a lot of kids that have attempted suicide to my hospital service, usually for medical clearance before they go to Wasatch Canyons or Uni or McKay-Dee. The last a child that came in did fine after an attempt at a Tylenol overdose, but I went into the room and And mom was in there crying and she said, I can't even look at you, doctor. I'm so ashamed and embarrassed. And I thought, you know, there's another patient in this room here. And it immediately occurred to me that this mother would benefit from perhaps talking to other mothers or parents about their experience with suicidal ideation, overdose, hospitalization, just to feel less alone. And also to see the light at the end of the tunnel, right? Like, get these kids through this, they grow up great. Are there resources like that? I mean, I feel like with every suicide or suicide attempt, there's several, you know, casualties, if you will, and
It's one of the
especially the
reasons
parents.
I love the peer support model is because if you have, like, they're doing it with overdoses, having a peer support specialist show up at the hospital to sort of counsel them through the crisis from a peer-to-peer sort of level. And I would love to see more of that if there's a suicidal crisis, the same kind of level of support being offered.
You know, we have our behavioral health team, but it's all clinicians, right? I think what they need is,
Well, the
Yeah.
AFSP has that. So if you go to afsp.org, the American Foundation for Suicide Prevention, they have what they call caring conversations. And these are people who have lived experiences and people can reach out to them. And they've been trained on how to help support peers. So
you know,
that's
we
a
need
resource.
to be proactive on it on our end though, because if you just give somebody the card or the number, I believe it won't happen. It's like put them on the phone with somebody that's lived that experience right there.
I'm not sure what the solution is for the reducing the stigma around it. I know when our son had the major crisis and was hospitalized, my husband had a much harder time with it than I did
Not
with my
surprised.
behavioral health background. And so I was able to take a sort of like, you know, this is normal and we'll just get through this. And he felt like he failed as a parent and, you know, like all of
Yeah.
that stigmatizing stuff that happens. And so I'm not sure, like, I mean, I teach and do this all the time and I talk to him all the time and it still didn't
Sure.
translate, you know? So I'm not sure how we get there as a society.
How does it influence the way you look at your work?
Well, so I'll just mention, so in QPR, we talk about all these behavioral risk factors. And so after my son had gotten through his crisis and was on the other side doing so much better, he had a life change where he decided to sell his pet and quit his Walmart job, which was a lame job, and he had something else coming up down the road. And he was living with us because he was still in this sort of, you know, we were trying to support him time period. But, and I was checking in with him regularly, make sure everything was good. And those life changes didn't throw me at all. And then my daughter's like, Mom, he's selling his pet and he's quitting his job. Like, is he okay? And I'm like, oh, I better check and make sure he's okay. Anyway, he was okay. And so it was all fine. And I like, okay, I'm good because I would have, you know, had more of a nervous reaction if there had been anything to be worried about at the time. But I'm like, I teach all the time to watch for these signs, and yet I had missed the signs, right? So, you know, I'm not, it's real and it can happen anytime. And there isn't any, you know, way to isolate ourselves from the crisis that can be there for people. And we don't have any control over other people's reactions. But the more we can build a safe community and a supportive community, and destigmatized community, then I think the more there will be that helping hand for people when they need it, and the more they'll be able to ask for it.
My name is Mark Harris. I'm from the University of Utah with these guys here. I'm the Associate Dean for GME, so I oversee our residency programs. And we've actually, after this gentleman passed the baton to me, he started a lot of our wellness activities, and we have a fantastic wellness service for our trainees, residents, and fellows. What I've been concerned about in the last year or so is the uptick in those mental health consultations that our trainees have been requiring and getting from our wonderful team. But being down here at this conference makes me think, because the reason I'm here is I'm trying to send our residents to get rotations in rural spaces and maybe even settle and practice work. What are you seeing and what do you recommend? Okay, so two parts of the question. What are you seeing amongst healthcare professionals, physicians specifically, but we're all in the same boat. And secondly, what do you guys as experts in this field recommend for us who are training these dogs as part of their training to build in that resiliency, that ability to cope with, because it'll be another crisis, right? It'll be something else.
You know, one of the things that I'm in a CMHC program right now, grad program, and they, one of the things that they pushed right out the gate was self-care.
Yeah.
Self-care, self-care, self-care. And it's something we've taught for 20 years in our office, and it's not something we practice very well. Like most mental health professionals, I think we kind of lack those skills to apply the things that we know to ourselves. But I think with our prevention team more recently, we have implemented not policies, but infrastructure that almost requirements for self-care, reporting and a buddy system and those kinds of things to check in with other people. And so we've kind of created a structure, since a lot of our people are working with at-risk kids several times a week. And they're exposed to things, and we're talking about hard topics. And so really promoting self-care that's something we've done, prevention mindset, you know. So
I've been enjoying the work out of University of Pennsylvania on resilience. And you know, this generation that you're teaching right now as doctors is the same generation that's having more anxiety disorders and that kind of thing, right? So they're part of this culture that maybe is somehow lacking those qualities of resilience. And so I know that University of Pennsylvania has been doing these trainings in the military. And they've got these 6 core components of resilience it's a pretty rigorous you know, evaluation, evidence-based program that they've developed to identify these. And like some of them are like mental agility, which you can teach that kind of cognitive flexibility with like some of the you know, cognitive behavioral kind of strategies, teach that kind of cognitive flexibility. They've got emotional resilience piece that some mindfulness strategies teach, but I think I would probably turn to something like that has a strong evidence base behind it, as giving people just a chance to check in. Where are you lacking in these resilience skills? And you're going to need these for your profession. And so let's brush up on any of those that aren't your immediate strengths, and they have some great strategies for how to build those strengths in people. And our first responders need them, our healthcare workers need them. There's a lot of professions that need that resilience.
It's interesting in medical literature, at least, those going into medical school, and I can't speak for nursing school or pharmacy or dental, they actually are fairly well emotionally balanced. And there's something in the medical education process where we break them. And honestly, no, it's true. And my interest
Well, and that's true of first responders too.
But yeah, no, it's the same. And I was 20 years in the military, same way in there. And I think, you know, my personal interest in wellness came about both my family and my sister's a psychologist, my other one's a social worker, and my mom was a psych nurse. But when I was a program director a long time ago in the Navy, I had a resident try to kill himself. Wow. I was a program director. I missed every thing. And so that's always sparked my interest. And we've done a lot. Like Mark, he's right. We have a great wellness staff. And they do actually a mandatory check-in with every resident program of our major programs, which I think has been really, really helpful. And then the psychologist does gatekeeper training for programs. So we're trying, but there's still something in the process. So I like all the prevention, but we got to figure out what we're doing wrong in the process.
Medicine breaks you. I'm gonna get a whole bunch of t-shirts printed and handed.
Yeah.
Medicine breaks you.
Well, that's what they think.
I mean, is it the trauma that they're facing on a regular basis?
Yeah, is it
that
moral
just
injury?
like-
Is it being treated poorly?
Personally, I think it's both.
Yeah.
And
I
I've
think
heard
it is the same as the first responders. You're wading through misery every day, no matter what specialty you're in. But then there's another component of medical training that breaks you. It's barbaric, and you shouldn't have people.
I mean, have you guys ever thought about doing like a focus group or something like that?
Oh, all the time, but they don't know. They have no insight. No, seriously.
I recently though.
Oh, well, no, they do, but this is, I don't want to take up a bunch of time. I'm happy to talk about this. But one of the ways it breaks you is it removes your self-analysis, so your ability to, because you can't be that insightful and survive. So they say it's, well, you guys should pay for lunch. And there's no, but the parking's half a mile away. So they focus on those things, which are a problem, but that's not the problem. You know, so, but I'm happy to talk with you afterwards. I don't want to commandeer
Well,
this.
our time is kind of up right now, but we want to thank our presenters this afternoon. With you, handouts, but